Okay, so here let's talk over. Let's go through this scenario, okay? Because we are talking about uh, diarrhea and AG and fluids therapy just recently. So this is a station, an OSC station, where you are called to review a 2-year-old child. The child is 2 year old, weighing 12 kg, and with a history of profuse diarrhea and vomiting for 2 days. And then on examination, the child is lethargic, and they are sunken eyes, and they are dry oral mucous membrane. And the child is poorly drinking, and the skin pinch is slow to return. Question 1, outline your fluid management of this child, 4 marks. Then question 2, list 2 likely causative organisms of this disease. Then in what circumstances would antibiotic therapy be indicated? Then in addition to fluid resuscitation, what additional I'm sure it was what additional measures are you going to take? I think the screen has been cut, but apart from the fluid therapy, what else can you actually do for this patient? So fluid therapy, first you have to, we know this is diarrhea and there's vomiting. So this is AGE1, AGE. We have established that fact. Then, apart from the AGE, the child is lethargic, sunken eyes, poorly drinking, and skin pinch. So this is AGE with severe DH2O. Severe DH2O. Okay, that's the diagnosis. So we rub this so that okay. So that's we have managed the diagnosis. So in severe dehydration, if the child is more than 1 year or more than 12 months, we still give 100 ml per kg, but we divide and we give in 3 hours. So we say 30 ml. So we say 30 ml per kg in 30 minutes. That's the first one which we are supposed to give. So 30 ml per kg, and the kgs for this child is 12. So that's just 30 times 12. So 30 times 12, that's like 360 in let me write somewhere. 360 mils 360 mils 360 mils in so this is in 30 minutes. That's the one we're going to give in 30 minutes. Then the other 70 mils per kg, we are going to say 70 times 12. 70 times 12 is going to give us 70 times 12. Where am I writing? So 70 times 12 is going to give us 840 mils. So this is ringer's lactate because this is severe dehydration. So we are giving IV ringer's lactate. So we are going to give 840 mils now in 2 hours 30 minutes, because the first one we gave in 30 minutes. This one, the last 70 mils per kg, are going to give in 2 hours 30 minutes. Then we are done with the fluid therapy for fluid management of this child. So these two likely causative organisms of this disease. So we have norovirus, we have rotavirus, we have E. coli. You can mention any E. coli, whether enterohemorrhagic, enteropathogenic, enteroinvasive. When you can mention there are a lot of causes of diarrhea, just any two causative organisms. Okay, but specifically for this question, it's better you just include those E. coli which can cause watery diarrhea, because for instance, what enteroinvasive E. coli and enteroaggressive E. coli, they usually cause bloody diarrhea. So think if you put those ones and those cigarettes and diarrhea, you can actually get this one wrong, because they don't cause watery diarrhea. So stick with those rotavirus, norovirus, and the equalizer that don't cause bright diarrhea. So we are done with this question as well. In what two circumstances would antibiotic therapy be indicated? So antibiotics would be indicated if there is one, bright diarrhea, there's bright diarrhea. Then if there is also uh, a foul smelling stew, foul smelling stew. So these are circumstances in which antibiotics would be indicated. Then for others, if you want to have more indications, you can also put when there is a high fever, like it's very high, that okay, this one might need an antibiotic. Then the other is if they are an actual sign of infection, but that's why I put it at the last part so that you know that okay. But these two, bright diarrhea and foul smelling stew, these are indications for antibiotic therapy. Okay, let me rub those. Okay, then you want addition fluid. In addition to fluid resuscitation, what additional? So additional, in addition to fluid resuscitation, and we've already talked about antibiotic therapy, the indication. So zinc sulfate. So zinc sulfate, 20 milligrams per kg for this, because this one is more than 6 months. So we are going to give zinc sulfate 20 milligrams per kg OD, not per kg, just 20 milligrams OD for 14 days, because zinc sulfate, it reduces the episodes of diarrhea, and it for more than 3 months. Then it also causes the epithelialization of the gastric and intestinal mucosa. That's what it does. Then the other thing you can give is you encourage the mother to continue breastfeeding if the child has not been weaned off, because some even reach up to 2 years without being weaned off. But if they have weaned off, then maybe it's okay. You don't have to encourage them to breastfeed. They just have to encourage the oral hydration. Then also you you give IEC on cooking foods. Always be watching the child, because of they like putting anything they touch, they put in their mouth. Then the other thing is, even food stuff they are giving a child, you have to do IEC on them. And then of course, most likely, most of the things will be cancelling to prevent on the preventive measures of diarrhea. So just cancel them on how to prevent diarrhea, and the zinc sulfate. And of course, for deworming, if especially maybe if deworming should be indicated if there is no history of the child being dewormed, then you can actually do deworming as well. So those are some of the additional things. Thank you for watching. Thank you. Please subscribe if you haven't subscribed, and see you next time. And if you haven't watched the video on diarrhea, please watch it. Just scroll to the channel videos and watch diarrhea, so that you become acquainted with the data. Okay, see you next time.